So we have our guest, Waleed Zaibai, who is a postdoctoral fellow at Yale. I would like Dr. Waleed Zaibfan to introduce himself.
All right, so hello everyone. My name is Malik Walid Zaib, and I am a graduate of Cyber Medical College batch of 2024. Currently doing some postdoctoral research and uh, here rotating in different institutions in the United States. So it's a pleasure to be here and talk about something that's very close to my heart, which is case reports and research. So yeah, thank you, Ahmed, for having me, and I look forward to a great session with you, everybody. So thank you for joining. Special thanks to Dr. Iqbal Haider for being with us. Thank you, sir.
Yes, I would like to. It is truly an honor for Dr. Iqbal Haider, Dr. Jahan Hassan, and Dr. Rubina. They have joined us. They have taken time out of their busy schedule to be here, and it reflects their dedication towards advancing research in Khyber Medical College. So, without further ado, we'll begin with our session. An introduction to case reports. So why do research? Everybody knows that, so we'll just skip that. Research is an important tool in the arsenal of every clinician, and nowadays it doesn't matter whether you are going to the US, England, Australia, Canada, or staying in Pakistan. It is extremely imperative that every student, that every clinician knows how to conduct good quality research. And it is every academic physician needs to be able to conduct research. So now we'll begin with case reports. So some people might argue that case reports lack the importance and rigor of larger controlled studies. However, this perspective overlooks the unique and significant contributions that case reports make to medical science. Case reports are invaluable for highlighting rare or unusual clinical cases, which can lead to the identification of new diseases, rare side effects, or novel treatment responses. Some of the things that we know about the COVID vaccine, how there were some adverse effects with relation to the vaccine. We had anaphylactic shock. There were patients going into arrhythmias, heart block. We know that because of case reports. Similarly, there were incidences of mucormycosis in patients with COVID-19 and who already had who were on immunosuppressive therapies. And we all know this because of case reports. So case reports are invaluable for highlighting rare or unusual clinical cases, which can lead to the identification of new diseases, rare side effects, or novel treatment responses. And they often serve as a hypothesis for and prompting larger, more comprehensive studies. Additionally, case reports have immense educational value. They provide detailed real-world examples that enhance understanding and learning for both medical students and practicing clinicians. They also contribute to the broader evidence base, informing clinical guidelines and practice, and engage clinicians in research, promoting a culture of inquiry and continuous learning within the medical community. So what is a case report? I've said so much about case report, but now we'll come to the point. What is a case report? It is description and discussion of a clinical case. And it is like the basic, I would say, the medical article. Because what we do in our wards, when we go to our wards, when we're doing our rounds, what are we doing? We are describing a case, we are describing how we identified that case, what were the diagnostic interventions, what were the treatment, therapeutic interventions, and what are the outcomes, and what is our plan, and how it contributes to our understanding. So that is what a case report is. And there are different types of case reports. There are many different types of case reports. We have just highlighted the four main types of case reports. One of them is a rare case. We see many rare cases. For example, there would be rare cancers, some types of lymphomas, they're extremely rare. There are cases of as I said, mucormycosis in patients with COVID-19, that was a rare case. Guillain-Barré syndrome is a rare case. But this, in the context of case report, these aren't rare cases. Rare cases in the context of case reports means like 1 in like a total of 3 or 4 published in the literature. We'll show some example of case reports. So you don't want to publish a case report just because it is rare. It has to be absolutely unique. The most important aspect of a case report is that it has to be unique. It has to be something that has not been previously published in the literature. Otherwise, there are many rare cases, but they have already been published in the literature. We already know everything about Guillain-Barré syndrome. We already know things about mucormycosis. So we can't publish that. But if there is a rare case report, if there's a rare mutation in a specific cancer, for example, we'll briefly describe some as well shortly. So we can target that. The second type is unique presentation of a common disease. This is, I would say, the most important or the most common types of case report. Unique, something that is common we see in our everyday life. And this is something that I would say most clinicians here that we have, Dr. Iqbal Haider, they probably see it all the time in their OPDs, that there are patients that present differently. They have a unique presentation. The third type is rare side effects of a therapy or treatment. And the fourth type is a novel procedure for a treatment of a disease. So now we'll describe some examples of already published. All of these examples that I'm about to share with you, they have been published by our own KMC graduates, and they've been published in PubMed index articles. So I'd let Waleed Bhai describe some of the published case reports.
Okay, so yeah, this was a case of sinonasal nut midline carcinoma. So just like Ahmed mentioned, that case reports can be of different types. It can be a rare disease, or it can be a unique presentation of some common disease, or it could be a side effect of therapy. For example, I used a drug for cancer, and it had a weird side effect, which I didn't know about, or which is not very well known in the literature, in the scientific literature. And another one could be even a failure of a drug that's known to work for a disease, but it didn't work, right? So this is one of the examples of a rare disease. When I was personally doing my core clinical rotations in my third year, it was one of the cases in the ENT department, and our attending told me that this is something I rarely see in the clinical environment. So if you guys are interested, I was more than happy to write about that. So by showing you this case report, what I want to highlight is that you might come across diseases which are not very common. I had never heard about what nut carcinoma is, and then I searched about it, and there were really any cases on that in the literature. And if even if there were, they weren't. They were children or like middle-aged people. Our patient was 62-year-old female. So this is one of the examples of if you see a case in the department, or somewhere when you're on your clinical rotations in back in Pakistan or somewhere else, and you see a case which you haven't seen before, and which you haven't read in the book, maybe that's the time to just go and sit and put that disease into Google or PubMed, and see if there are any cases on that. And if there are, compare that with your case, and maybe it's a good area to write about that case. So this is one of the examples. Yeah, this is another one. It's you can see when one of my seniors, he's a internal medicine resident, and he told me that I have a case, and it's metastatic fibrosarcomatous transformation of dermatofibrosarcoma protuberans. I was like, what are you even talking about? Then I went to the literature and I searched about it, and I did know about dermatofibrosarcoma as a soft tissue tumor, but then the metastatic fibrosarcomatous transformation, as like it metastasizes, and then it has a fibrous and sarcomatous changes. So there was a pretty unique thing, and then I told him I can write about the case, and I searched about it, and then it had metastasized to the lung as well. So that was a unique presentation. So what I'm trying to highlight is that this is the second type. It's not like dermatofibrosarcoma protuberans is not a known disease. It's pretty common, not that common, but it is known to the physicians. But what was different was the metastasis to the lungs, and it being, it's mostly it's localized, right? So if, for example, you see a case of melanoma, or you see a case of squamous cell carcinoma, or you see a case which is which doesn't really metastasize, or a unique presentation. For example, you see in your ward a case of pancreatic cancer, which presents differently, right? What we're talking about is a unique presentation, right? For example, normally a case of pancreatic cancer will present with somewhere 50, 60 age, and usually a chain smoker, and then having some weight loss and some chronic abdominal pain with chronic pancreatitis, and well established, or even if not, the patient will have some abdominal symptoms. But let's say a patient just presents with jaundice, that's all you can see in the patient, and then maybe you do a CT scan of the abdomen for something else, and you find out that the patient has some calcifications in the pancreas, and then you find out that the patient has a pancreatic cancer. Maybe that's a good area to now write about that. Okay, guys. One thing I learned when I was preparing for my step one exam was a patient with pancreatic cancer presenting with depression, like psychiatric features. So this was another thing for me. If, for example, a patient doesn't have any signs, and a patient gets depression and is in that age and is a smoker, and you can suspect that cancer, and then when you do a CT scan, you actually find out. So that could, this unique presentation is somewhere where you actually might want to write about. This is the third example: rare side effects. So, for example, like I mentioned, usually drugs in oncology are the best ones to explore more, because there are always new drugs coming in and old drugs going and not working and failing, and always new therapies like biologic agents, immunotherapies. Even recently, we had a grand round here in one of the hospitals, and in that they were discussing immunotherapy as the new emerging therapy for type 1 diabetes. So these are the places where you can, if, for example, any drug in pharmacology, it does have some sort of side effects. So, for example, this is aplastic anemia caused by a drug which was used for some other condition, right? So bendamustine is a drug used in oncology, which did cause some anemia, but causing a full-blown aplastic anemia with decreased WBCs, platelets, and RBCs, and a patient getting severe thrombocytopenia and anemia. It wasn't common. It wasn't known. So then we decided we should write about that, and this is one of the examples for you to if you see a rare side effect of a drug. Yeah, for example, so for people who are in third, fourth year, and you're in the ward and you see a patient, and you ask your attending, your physician, and he or she tells you that, so this patient used this drug, pembrolizumab or infliximab, and now the patient is having hair loss, or the patient had a GI obstruction, or the patient had aplastic anemia. Maybe that's the time to go and search at home if this drug really causes that side effect, and is that really common? If it's not, you can discuss with your physician, and you can write about that, because you want other people to know, not for the sake of just publication, but for the sake that other people come to know about this. Okay, when you're prescribing this drug, you need to be careful about these side effects, right?
All right. Yeah, and this is an example of a new procedure. So most of us who have read pathoma, obviously, or pathology, they know that ventricular septal rupture is a dreaded complication after myocardial infarction. And it can happen very rarely. There's almost like 0.1 to 0.2% incidence of ventricular septal rupture in the days following 3 to 4 days after myocardial infarction. So this was a case in which there was a patient who presented with ventricular septal rupture after myocardial infarction. So just because it was a rare case, we couldn't just publish it, because as I said, it doesn't have to be, just because it's rare doesn't mean you can publish it. It has to be unique as well. So what made this paper unique was that there was a very new treatment approach that was done for this patient. So usually for ventricular septal rupture after MI, medical treatment is associated with 100%, almost 100% fatality rate. Surgical intervention, on the other hand, is associated with 50% mortality rate. So the ventricular septal rupture carries a very high mortality rate. So for this patient, what the attendings did was that they put him on a mechanical ventricular support device that mechanically increased the cardiac output in order to allow the patient to not remain in shock and basically to maintain his circulatory system. And at the same time, the surgery was delayed. So what we said in our case report was the advantage of delaying surgery is that they can allow the ruptured septal to scar. Because initially, if you just do surgery without letting the tissue scar, letting the tissue heal on its own, then the tissue is, as you can expect, if there's a wound, it is very friable. It can be easily damaged further. So we let the attendings let the tissue heal on its own scar, and then they healed it. Then they did the procedure, and the patient had very good prognosis. So this is another example, as we've said, a new procedure for a case. All right. So now we'll proceed further. And these are the importance, as I've mentioned before, this is the importance of case reports. We are presenting newly found conditions, manifestations, disease mechanisms, effects of drugs, and many more. And they're important for teaching of students and health professionals as well. So this is the structure of a case report. Pretty much every case report is going to be along this structure. The first is the introduction, then there's the case presentation, and then there's the discussion. So the introduction section, we include a brief background, which includes a brief context about the condition or issue being reported. You have to write about what is the incidence, what is the disease, what is the side effect that you're reporting on, overview of relevant literature to establish the significance of the case, explanation of why the case is unique or noteworthy. And then you have to mention the purpose of your case report. It has to be a clear statement of the aim or objective of presenting the case. And then you have to mention specific reasons for choosing this particular case and the clinical relevance. A very short line. This introduction is usually very short. It is around like 100 to 200 words, or even less than that, around 100 words. And then you have to mention the clinical relevance, explanation of how the case contributes to clinical practice, and potential implications for diagnosis, treatment, and management. All right, so then we move to the case presentation section. All right, so yes. So the first step is patient information. In patient information, you have to describe the basic demographic details, age, gender, ethnicity, and relevant medical history, presenting symptoms and chief complaints, and clinical findings. In clinical findings, you have to mention detailed description of physical examination results, vital signs, and other significant clinical observations. And then we move to the diagnostic assessments. In diagnostic assessment, we have to mention summary of diagnostic tests performed, including laboratory tests, imaging studies, and other relevant investigations. And then results and findings from these diagnostic assessments, what we know, what was the diagnosis, and then we have to move to the timeline. And timeline, you have to mention a chronological sequence of events from the onset of symptoms to the presentation, diagnosis, and treatment. And it has to be clear and a concise timeline to help the reader understand the progression of the case. Timeline is extremely important. You have to go in a sequence. And informed consent is obviously it's absolutely imperative. And there are different informed consent applications available on different the websites of different journals, and you can access that. And you have to take a proper informed consent from the patient. All right. Then you have to mention about the intervention or treatments. Intervention or treatments, you have to mention the detailed description of the treatment plan, including medications, procedures, and other interventions. Rationale for the chosen intervention, why we chose the particular treatment plan, and then we move to the outcomes and the follow-up. So information on any follow-up visits, monitoring and the patient progress over time, and of course, outcome is extremely important. Were there any complications or unexpected developments? What was the outcomes? Did the patient survive? Did we have any side effects? All right. And now this is basically the main case presentation.
Okay,
Dr.
Ahmed.
Waleed,
Uh,
add something.
all right. What do you want to say?
If you want to add something, I was asking if
Yeah,
you want to
yeah.
add
Yeah.
something,
So
you can add it.
thank. That's what I was gonna do. So, in the introduction, I want to share an introduction of one of my published case reports, and I want to quickly go over that for you guys to see. I'm putting it in the chat box. I hope you guys can uh, see that now. One second. Uh-huh. Mm. Emma, can I take over and present something, and then you can go ahead and share your screen then?
Yes, absolutely. Yeah, you can do that.
All right. So I'm gonna share a window. One second. Mhm. I think it went in the screen mirroring. Okay, no worries. You can go ahead with sharing your screen. I'll just read my case description. So I'm okay. One thing I can do is I'm putting the link in the chat box, and you guys can open that and go with it with me. So it's the nut carcinoma case. I just want to highlight a few things so that you guys are able to understand really well what we just discussed. So if you open this link, you'll go to the case of the it's the study title. It's on PubMed. The first thing you see is the abstract. We'll come to the abstract at the end of the session. First, go to the introduction, and if you read the introduction, you'll be able to see that initially we start from journal, like generally, like what nut carcinoma is. So I didn't know what nut carcinoma is. You didn't know either, for example. And now, if you're talking to a layman, I mean a medical person, but he or she doesn't really know about the condition, what you do is you start with the general. For example, you go to literature, you just go to Google and put sinonasal nut midline carcinoma or nut carcinoma or anything like that. And when you search that, you will get a lot of papers, review papers, some original studies, some case reports, and then you can go to any of the good papers which is published in some good journal, and then you can read that, and in there in the article it will be evidently written that this is a type of squamous cell carcinoma, and this is that, and they have described it, what is the mutation involved, what is the. So what I like to do usually is what makes it easier for me to do is I just open an MS Word file and I roughly write, okay, so squamous cell carcinoma. I find out that it is a type of squamous cell carcinoma. Now I want to talk about squamous cell carcinoma. So there are a lot of types of squamous cell carcinoma, like esophageal, like this, like that, in the head, in the digestive system, everywhere. Near midline carcinoma is one of the squamous cell carcinoma types. This is my first point. My second point is, where does it arise? Does it arise in the cranium, in the chest, in the abdomen, in the legs, in the hands? Where? I'll pick those lines like I've mentioned. The midline organs, such as the mediastinum and upper aerodigestive tract, provide the origin for it, of one of its subtypes, and hence known as nut. midline carcinoma. So what I wanted to explain, why is it called midline carcinoma? And then you want to talk about the age. Which age is it most common in? What gender is it most common at? Like basically the demographics. Is it common in males or females? Is it common in children or elderly or middle age? What is the median age of diagnosis? Is it 30 years? Is it 4? And you don't write this from your own. You just go to literature, you find those lines in different studies, and you put it here in your MS Word file, and then you copy the reference and put it in the references section. That's how you go. Then that was the first thing, right? We discussed the background. Now another thing was the the purpose of your case report. So if you come down and you read, unfortunately, nut carcinoma has a poor prognosis of whatever 9 months. It has been observed that tumors larger than 5 centimeter have a worse prognosis. But what I wrote here was, in our case, the patient had a seemingly larger tumor, yet her overall survival surpassed the median overall survival because she survived for years. So that's where the purpose of my case report comes in. Why am I writing this? What was the need to write that? Because I wanted people to know that, okay, yes, median survival is 9 months, but there could be patients who can live longer, right? And then the last part was the rationale behind why are you writing the case? I mean, the purpose is different. And then the third thing, let me see, it was third thing was the clinical relevance. So if you see the last line, that's where the money lies. It is worth noting that an older age at presentation and a negative P63 status appear to be associated with better survival rates. That's the one line summary of this whole case. So, for example, if you see a patient with midline carcinoma with a negative P63 mutation, because most of them have positive mutation, and then most of them present in like 23 is the median age, lower ages are the common ones. But if they are elderly, so it is worth noting that, like in our patient, it could mean, if it's elderly and p63 is negative, it could mean a good prognosis. So, and interestingly, I'll discuss that thing in the discussion, because that's a very interesting point, how introduction is different from the discussion part. So Ahmed, you can go ahead. And the case description is simple, like you present your case in your ward or your clinical rotation. So the most important thing is to mention the age of the patient, the past medical history, the presenting complaint of the patient, and one important thing, you don't write a 62-year hypertensive male. You write a 62-year male with hypertension. With this, you don't label the patient as alcoholic or hypertensive. This is a male, 62-year-old. Then this is the presenting complaint. Initially, it is good to not write the diagnosis. Don't write the patient had, for example, upper GI bleed. A 62-year-old patient presented with upper GI bleed. A 62-year-old patient presented with bloody vomitus and this and nausea. The symptoms. Why did the patient come? And then you mentioned the past medical history. The patient has a past medical history of type 2 diabetes, controlled or uncontrolled. The patient, it is very important to write what medications the patient is on and how is he controlling the disease. And then you go down from there. So the presenting complaint, chief complaint, past medical history, and then the timeline. So importantly, number one, never mention the hospital's name in the case report. Don't mention Khyber Teaching Hospital or anything like that. Just mention presented to our emergency department or our internal medicine department. And then never mention the patient's name, never mention anything that could help identify the patient. You never mention that. That's important. And then never mention the dates. Like, don't mention that the patient presented on 24th April and on 30th April MRI was done, on 6th May this was done. No, mention that the patient presented on day one, and for example, and then 5 days from then this happened, 6 days from then this happened, 10 days from then this happened, right? So the timeline is important, but uh, importantly, you don't mention anything that would help identify the patient. This is the HIPAA violation thing. You don't want the patient details to go out. You just want to discuss the case. And another important thing, if you want to mention an image, like a clinical image, like an MRI scan result or something, make sure you crop out the patient's details, right? You have to crop out the details. You just put the image and label it, and that's all. Make an arrow to the area which you want to describe. For example, you can see an edema in the knee or whatever the joint. So make an arrow to that and explain it in the, or let's say if it's a histological scans, if you're talking about RBCs being spherical or whatever, like in a specific shape, so or the platelets or something, make sure you make an arrow and point that out so that a layman can also understand what's the, not just a hematologist, right? So just a few points where you guys, these are the points which really make a paper stand out than a paper which doesn't really go anywhere. So I just wanted to highlight a few things. So thank you. You can go ahead with discussion.
All right, so now we'll move to the discussion. Thank you, Walid bhai. So in discussion, you want to begin with summarizing your key findings. You briefly state the main findings and outcomes of your case and highlight what makes this case unique or significant. And you can compare it with existing literature, how it compares with other studies of the same, which compare the same disease. And then you have to discuss how this case aligns with or deviates from established knowledge or patterns. Then we move to the clinical implications, discuss the implications of the case for clinical practice, and you have to explain how the findings can influence diagnosis, treatment, and management strategies. You also have to mention the mechanisms and pathophysiology behind your case report, as well as I explained that what is the condition that you are studying that you have mentioned in your case reports. You have to provide an explanation of the underlying mechanisms and pathophysiology relevant to the case, and you have to discuss any novel insights into the condition that this case might provide. And then we move to the strengths and limitations. You have to outline the strengths of the case report, such as novel insights or successful outcomes, and discuss any limitations or constraints, such as a lack of generalizability or missing information. As well, I said that, for example, the patient may have presented late, or in our setting, the patients, they usually don't receive vaccinations, they delay treatment till the very end, or they go to quacks. So you can mention all of that in this section as well, and offer practical recommendations for clinicians based on the case findings, suggest potential changes or considerations in clinical practice, and future directions. So you can say, as we've said, that case report, it can generate hypotheses for other studies, such as cohort studies, even randomized controlled trials as well. For example, how do we know that these semaglutide, the Mounjaro that is nowadays being used for weight loss, it was initially developed for diabetes, for the treatment of diabetes. Nowadays, it is being used for everything from cardiovascular disease to weight loss to even now it is being used for chronic kidney disease as well to improve cardiovascular outcomes in patients with CKD. So all of this we know through case reports, and these case reports mention that study needs to be done in this area, and then large-scale studies such as cross-sectional cohort and RCTs are done, which can then which generate proper clinical evidence. And lastly, we have to mention the conclusion. And in the conclusion is just basically a summary of the main takeaways from the discussion, and you have to reiterate the importance of the case and its contribution to medical knowledge. And including these elements ensures a thorough and reflective discussion that contextualizes the case within the broader field of medicine. So now I'll give the floor to Walid bhai. He wants to talk about the care checklist.
Yeah. So this is a very important thing. So whenever you write a paper, it's not like you miss certain things, and that's why, like in clinical practice, whenever, for example, here in the hospitals, we have like checklist for patients. And for example, sometimes patients come in, they're admitted, and we forget to give them, DVT prophylaxis, heparin or something. And these are the things which we forget: the fluids, how much or what medications we do have to adjust. So there are always checklists that we run on every patient at the end of the round, so that we don't miss anything. The same goes for a case report or any paper. A checklist, this is a checklist which has been devised by researchers, and to just formulate a checklist, and a points that if I'm writing a case report, I don't if I finish my paper, I compare my paper and see if I have missed anything in the checklist, right? So if you want to get the actual checklist, I am putting a link in the chat box, and you guys can go follow that and get the link from the checklist from there. So if you look at the checklist, the first thing is the title. So the title should, if you can mention in the title case report, that would be good. For example, a rare case of P63 negative sinonasal midline carcinoma in the elderly, a case report, or a rare case, or something like that, so that if someone even looks at your study title, they directly know that, okay, this is a case report, right? So it's usually good to mention the term case report in your study title. Then the keywords, right? So keywords are the that, like, for example, if someone wants to search your case in PubMed, if you put the keywords, they'll get the article as well if they don't know the exact title. For example, for this paper, I can put squamous cell carcinoma, P63, I can put nut carcinoma, and then midline carcinoma, and then one of the key terms or keywords should be case report, right? It should be case report, one of the keywords, because the paper is actually a case report. That's important, right? Then the abstract, which we'll talk about at the end, and then introduction. So one or two, if you look at the point 4 in the care checklist, I'm does everybody have the checklist on board? Or Ahmed, you can even share the screen of the link that I shared. So the introduction, one or two paragraphs summarizing why this case is unique. So it could in so references, if you want to cite a paper, you can cite it in the introduction. That's completely fine. Mainly the citations go, references go in the discussion, because that's where you discuss and compare and see old literature. Because in introduction, you're just giving the background, like I mentioned earlier, and then the clinical relevance and the purpose of your case report. Sorry. So, and then the patient information. So if you look at the checklist, one of the points is the identified patient specific information, which I mentioned. You don't want to mention the patient's name or any specific details. It's fine to put the age, because that's scientifically important. A name is not important. I don't Not knowing a name doesn't make any difference, right? And then primary concerns and symptoms. So when you have written your case, compare it with the check. Okay, have I written the primary concerns? Yes, chief complaints I've written. That's fine. Symptoms, like I mentioned, don't mention diagnosis. Don't say upper GI bleed or varicose bleed. Mention bloody vomiters, nausea, hypotension, dizziness, or whatever like that, right? So don't mention shock. Don't write cardiogenic shock, right? Palpitations, right? Breathlessness, right? Sweating, terms like that. Symptoms, don't write diagnosis. Then medical and family and psychosocial history, any genetic information, because that's important to know. For example, one of the cases we sent to a journal, and then it was a side effect of a drug, and the editor actually asked me if to mention all the drugs the patient was taking, just to clarify that, okay, whatever happened to the patient wasn't because of something else, right? Or any other medical condition, right? So that's important. You can't miss any medication that the patient is taking. Probably that could be the case. That could be the something that will be contributing. And then relevant past interventions with outcomes. Again, any past medical history, surgical history. Then describe the significant physical exam and important. Have you described that? Yes, I have. Okay, mark a tick. So whenever, this is my suggestion, whenever you write a case report and you're sending it to a journal, it creates a very good impression if you take this checklist, download it in PDF or MS Word, and then put a tick mark against every point which you have written, and something which you haven't written, put a small description, a brief reason as if why it doesn't apply to your case. That creates a very good impression, because the reviewer, if they want to see, they can just look at the care checklist and they'll see, okay, this person has done these things, and if not done this, why, and that's, they are more clearer, because that increases the quality of your paper. Then historical and current information, the diagnostic testing, what testing was done, what were the challenges, was it difficult, any cultural barrier, and in the testing, anything, did you miss anything, did you have to do an MRI just because something was missed on a CT scan. Then diagnosis, what diagnoses were made. Then the prognosis, for example, staging in oncology, which I have, if you read the case I shared with you guys, you'll be able to see everything. Like if you go through the checklist, you'll be able to see, okay, these points have been addressed, right? Then the types of therapeutic intervention. What did we do? Did we give drugs? Did we give any medical treatment, conservative treatment, any surgical therapy, anything? Mention that. That's important, right? Then how much dose was given? This is important. If you did radiation, don't just say the patient got radiation and chemotherapy. No, the patient got 6 cycles of radiation, and then for example, a 20-day course of pembrolizumab, this much dose every day, for example, let's say 500 milligram every day or every other day, because that's important. That decides the clinical guidelines in the future. Your case report doesn't decide that, but that contributes to the literature. So you don't want to, miss anything. You go to the details and mention every single point. It's fine to overwrite than to miss something. This is one of my first mentor with whom I did one of my papers. He told me, I asked him what should I write and what should I not, and he was like, "It's fine, write everything, and then we can decide which are the points we need to exclude." Right? So it's fine to write, because the journals have a word limit. So it's good to write everything and then decrease the word limit if the journal has a limit. If not, write everything. That's usually the safe approach. Then administer therapeutic intervention, the dose, then changes in intervention, the clinical and patient assessed outcomes, important follow-up diagnostic and other test results. So, just put a tick mark just to make sure that, okay, yes, I have written that these things were done. Then intervention adherence, very important. How was that assessed? So, for example, we kept the patient under monitoring for medication adherence and to look at the response to treatment. And the patient was in the ward, inpatient. So it's not like the patient went home with the drugs and we don't know if the patient took it or not. You have to say if the patient did take it or not, because if he or she didn't, that could be the reason of the failure, not actually the drug being the failure, right? So then adverse and unanticipated events. Again, if there was some odd side effect, adverse event, you do mention that. A scientific discussion of strengths and limitations. This is the part where you go to the discussion. Now we are in the discussion. Look on the left hand side, discussion portion. So strengths and limitations associated with this case report. So limitations are usually for example, one case doesn't, it's not like our case was this, so it works for every patient, or our patient with this drug had this side effect, so everybody is going to get that. No, that's, of course, this is one of the biggest limitations of case reports, that it doesn't dictate clinical guidelines, because one case doesn't dictate that. For that we do clinical trials, but it does contribute to the clinical literature. That's the most important point. And then the strengths, of course, for example, this is a unique case, or don't mention this. See, this is an important point. So when you're writing your case, don't mention this is the first ever case of Down syndrome, and this is the first ever this. Don't research. We don't use terms like that. To my knowledge, this is one of the very rare cases of Down syndrome presenting with intestinal obstruction, and the patient used this. Don't mention. Don't get too excited with your paper. You found something right about that. Maybe I'm talking from experience, because once I sent a paper to a journal, and I had written something, not even like, I just mentioned that this is one of the very rare cases or something like that. And the editor sent me a whole list of cases. And to be honest, I didn't know about that. And because he searched a lot of databases and he was like, I can see hundreds of, like he mentioned at least like 10 cases. Our paper still got published, but he just wanted to change the direction of our case, right? So it's important. What do you want to highlight? That's the most important thing. Do you want to, one of the cases I sent to a journal, and what I had written about was the unique presentation of the condition, right? The editor told me to make it about the failure of the drug, because actually what happened was that we used one of the oncological drugs and it didn't really work. But while in literature that was the standard of care, and he told me, why, okay, why not you make it about this? And he made me change the whole title of the paper, the whole, I had to rewrite the whole paper, which was the best experience for me, because I learned, when you don't focus on one single thing, like a unique presentation, it could be a different aspect that, the editor told me about that. And then I wrote that and he was happy to accept the paper, right? And then intervention adherence and discussion, the scientific rationale of any conclusions, the primary takeaway lessons. So I don't, it will be too much time consuming if I go and discuss every point in discussion on my case, but you can just go and read the discussion, because the discussion is the heart and soul of the paper. That's the most important thing, right? So one second. Sorry for. Okay. So then, then the last point is the patient perspective. If you may or may not write that the word, this is important. The patients should share their perspective in 1 to 2 paragraphs on the treatment they received. So sometimes you can even have the patient tell you, okay, what was your experience of using this medication, the side effects, how horrible it felt, how how good did you feel about that, and stuff like that. It's not necessary to write, but sometimes in some cases it might be a good point to use that. So if you have written that and it's relevant, you can tick mark it. If not, just mention why it wasn't that important. Like I'm just talking about a unique presentation, so it's not like I'm giving any medication. So this is important to write why you didn't write anything. And the last thing, let the patient give informed consent. This is the most important thing. So whenever you are sending your paper to journal, whenever you decide ethically, the first thing you do is go to the patient, tell the patient, okay, we think it's something important to write about, and if we have your permission, we can go ahead with that. It's usually good to have something on paper, right? This whole thing, or you can get like templates of consent, patient consent, download that, print that, and go and get a sign from the patient. So if the journal asks you, you can send them, okay, yes, we have the patient's consent. And on every paper, the manuscript, the main file that you send, do mention patient consent. The patient, we obtain written informed consent from the patient to report their clinical details and images or whatever, right? So I hope that helps. This is a very good checklist that you must go through whenever you write your paper. And preferably after you have written your paper, and then you can compare, and do send this file to the journal as well with your paper. It will increase the impact, right? Thank you. Ahmed, you
At
want to go ahead?
last,
Okay.
we are we have reached the end of our session. Thank you everyone who joined. And I would like to say something, that the thing is, it is extremely important to be extremely professional. You have to know how to address your elders, how to address your colleagues, how to address your consultants, even those who are your juniors. It is extremely important to maintain a professional attitude. And irrespective whether you don't know the credentials of a person, you have to maintain a very courteous and a very professional attitude. And this is something that we don't focus on here in Pakistan. But if we think about, if we go to abroad or England, or even anywhere pretty much abroad, even in some areas of Pakistan, for example, in some other colleges like Karachi, Dow Medical College, Aga Khan in Karachi, even King Edwards, and they, even if a professor is like in unprofessional towards with their students, they are reprimanded for that. So it is absolutely vital that the students are extremely professional, they're extremely courteous with their doctors and with each other, with their juniors. And one other thing that I would like to add, that it is actually a sunnah of the Prophet, peace be upon him, that if you know something that can benefit a person, you should definitely help them. It was, I think, in the last sermon of the Prophet, peace be upon him, where he said that those who can listen, or those who know, it's not an exact quote, but those who know, that they should tell it to the one who doesn't know. Like, so this is something that has resonated with me, and that is something that we should focus on and learn. And another thing that I would like to add is that we have now developed a research forum. It's a Google form in which students of Khyber Medical College who want to do a study, they can apply, they can present their own proposals, and we'll assign them a mentor and give them access to a faculty director as well, and that will help them in every step of the research journey. So now I'd like to ask Dr. Jahan or Dr. Rubina if they want to add something. I think Dr. Iqbal left. He had to go to the hospital.
Assalamu alaikum, Dr. Jahan Hassan here. Uh, it was
Walaikum
indeed
assalam, sir.
it was indeed a nice session. We learned a lot. There was something which was completely new for me as well. I think the students will get help from your mentorship and SRC as well. I'm extremely thankful to my ex-student, Mr. Waleed, for his nice presentation and his nice ideas. Thank you so much, President SRC, for organizing such a nice webinar in which we have, I think, more than, it was almost 50 or 57 participants were there. Nice words at the end by the President. I appreciate it. Extremely nice. Thank you so much, all. That's something which I could say. Thank you all.
Thank you, sir, for the kind words. All right, so that brings us towards the end. If anyone of you who has a case report or wants to conduct one, they can contact with us through the SRC email. We can guide them for the case report. And I think there was a question about choosing a journal. Yeah, we'll share the PDFs as well. I think all of the cases that the PDF of the presentation, yes, we'll share that as well. And all of the
Okay.
cases that we mentioned, they're free cases. You can view that. So how to find a journal for your case report? So unfortunately, this is a problem. Most of the journals for case reports, they are paid, and you have to pay. Even the ones that we have published in the European Journal of Case Reports in Internal Medicine and Curious, they do charge a small fee. The European Journal of Case Reports in Internal Medicine, I think it is one of the best journals to publish case report. It has an impact factor of around 2.14, which is really good for a journal which publishes only case reports. And it charges a small fee. So what you can do for that is you can contact residents or consultants. So when you write a case reports, you can contact them. And this is something that is ethical as well. This is accepted. You can mention that for funding, you included this person, and you can include them in your paper, and they can fund the case report. And there are also some journals which publish for free. For example, I think it was one Dr. Iqbal mentioned as well, Journal of Medical Case Reports. There are a bunch in Pakistan as well. And no journal, I would like to stress that there is no journal that is, I would say, small, that isn't worthy of your publication. It doesn't matter if the journal is indexed in PubMed or not. You can mention it on your CV. You can mention it in your ERAS application if you're applying to the US, or if you're doing PLAB, or even if you want to mention it for your CPSP, your FCPS training. You can mention any journal which has a DOI. You can mention that. It isn't a problem. Another journal is British BMJ case reports. I think they publish free case reports for Pakistan, so you can look into that as well. And there are some journals, Wiley journals, which I think offer 50% off for Pakistani students. So people can look into that as well. And if they need any
Yeah.
help in formulating your research titles or your research or your case reports, we can help them as well.
Yeah,
Walid, you want to
few,
add something?
yeah, just a few points. So, thank you, Dr. Jahan Hassan. Thank you, sir, for your kind words. And I just wanted to mention, I think Dr. Rubina Gul also mentioned something about, I don't know this platform that you mentioned, but yeah, thank you for that. And I do think there are platforms you can put your abstract in. Even elsewhere has a journal finder, and you can just put your what I usually do. ChatGPT is the my best friend, so you can just put your abstract in there and ask ChatGPT, okay, what journals do you recommend? So, but sometimes it gives you very big journals, but that's to be mindful of that because it doesn't look at your condition. Or you can tell it, okay, give me journals which have low costs or stuff like that. And that's the one that's usually the first thing I do. And I have a list of like 5 to 6 7 journals. And usually when you publish a few cases or a few papers, for example, European Journal of Case Reports in Internal Medicine, the editor John Keller, and when we send them the paper, they give us like the decision within a day or two. It's rejected or accepted. Like now, you develop some familiarity with the journal. You know what kind of cases they like, and there are cases we write, and I know that they'll accept. And then there are I just want to give a shot, and I'm like, okay, let's try. And I know I have a backup journal, so always have backup journals. It's usually good to have that, and because it's very one of the things that really is difficult in publication is to prepare your paper according to the journal's directions and guidelines. If some would say we want references in this style, some would say these words limit, some would say make the title like this and introduction, some would need abstract. So it's usually good to prepare your paper for 1 to 2 journals and have another author prepare the paper for the third journal, and then you can submit it to the first one. If it doesn't take it, go ahead with the second, go with the and important point, any paper you write, don't let it go to waste. Get it somewhere. You can present your paper in your med school. You can present it in any research conference. Abstract. So we didn't talk about abstract. Just I'll take. I think we are already over time, but if someone wants to leave, they can. I just want to not miss an important point. So abstract is the summary of the paper. So you wrote introduction, case description, discussion, conclusion. Abstract is a short summary of that whole paper, a 1 page, usually 100 to 250 words. And then you can submit the abstract to different conferences, right? For example, we presented a case in European Congress of Internal Medicine in Turkey, and it's going to happen next year as well, and then again. So there are always usually conferences and stuff happening around. Be on the look for that. There are also local conferences like Peshawar Medical College, Khyber Medical College has been doing that thanks to the research committee. And then you can present in AKU, Shaukat Khanam. So make sure you send your abstract to different conferences, different research workshops, and usually you can present your paper in multiple conferences. If it's some local conference, you can always send it to international this case report, the one I mentioned. So this abstract has been published in there was a best case reports contest in Poland, and I sent the paper there, and they accepted the abstract. So the abstract is published in the abstract booklet of that research workshop. There are abstract proceedings. So whenever, for example, there is a conference of American Heart Association, some European Congress of Internal Medicine, anything like that, when you send them the abstract, it goes into the abstract proceedings if the paper gets published, and you also get to present the paper in the conference as a poster or as an oral presentation. So in the CV, I'm not, different people want to go to different places in the future, right? If you want to stay in Pakistan or the US or the UK. So I know about the US, they have the ERA CV, they have specific place for oral presentations, poster presentations. So you can put your paper in the poster or oral presentation, as well as when the paper gets published, you can publish it in you can put it in the actual presentation as well. But thank you once again for being with us. I do have a lot to say above that as well, but Ahmed just texted me that we are already over time, so let's see you guys in some other session. And you can always reach out on the email. I'm putting my email if someone wants to discuss or collaborate on any project. I'm happy to help, and thank you for having me, everybody. If someone has any question, you can put in the chat or ask right away or send over the email. And Ahmad, you can end up the session if you want to end it up with something. Thank you, everything. Thank you, sir.
Habiba, you can end the session. Thank you,
All
everyone.
right.
It
So
was
so
truly a
thank you,
great
everyone.
experience.
I hope it was a your learning experience, and we hope to discuss further different types of papers and publications in the future. Hopefully every other week or every month. So thank you for having me, and thank you for being there. Thank you the faculty and everybody who is enthusiastic about learning. So you can leave the session now. Thank you. Thank you.